Well, in general terms, the mayor had what affects a lot of Americans here, where he had a heart issue and he had what you would call a heart attack. And in Hilo, when someone comes into the emergency department having a heart attack, as you can see behind us, we're not quite there yet to actually fix or treat the heart attack. So what happens is that the patient comes in and we give them a good treatment, but not the best treatment, which is a medication that in most cases will dissolve the clot in their heart that's causing the pain. It basically is a plumbing problem. It's like your drain is clogged up and it has to be unclogged to make everything work again. What we're looking to do in the future is, instead of having patients right now who come in, get this medication, and then go to Oahu to get their plumbing fixed, is to actually do that here in Hilo, which is better for the patient because you can do it quicker, and also so that you can avoid having to give the patient that medication. Basically, what you've been looking at here today is a cardiac angiography suite, or what we plan in the next 2 months to be a cardiac suite. Right now we use it for angiography of the legs, and we've been doing that for a number of years. We've installed equipment which basically allows us to look at the heart and do what you would call the standard in places like Oahu when it comes to not only looking at the heart but actually fixing problems with it. You only have a couple hours of, I guess, prime time to fix a person's heart before it receives any damage. And so they call that the golden window. So obviously, if you don't have to travel and you can get your care right away, we get more people who can get help within that golden window. I can say our timetable is approximately 2 months from now. We hope to be doing our first diagnostic cath here in this same room. We have staff who are training at Queens currently to get some of that expertise. If everything goes well, we'll go to the state regulatory agency that controls these things and ask for basically permission to start actually treating people's heart attacks, not just looking at their heart.
Well, right now we're at the infancy state of the cardiac cath lab, and like Dan mentioned, in 2 months we'll be ready to go. We got qualified, competent staff ready to go. So all we need is our cardiac cath specific training, and we'll be able to do our first patient.